Welcome to Personal Beliefs Exemptions to Immunizations Required in California. Changes for 2014 and beyond. This presentation will review revised procedures beginning in 2014 for requesting an exemption to an immunization otherwise required to attend grade school or childcare in California. This presentation is available on the Shots for School website, located at www.shotsforschool.org. The Shots for School website is a detailed resource about school immunization requirements in California. The website will be mentioned often during this presentation. In this presentation, we'll briefly review immunization requirements and exemptions. We'll also provide information about when documentation is needed, how to complete the required documentation, and where to find additional resources and information about the school law. For many decades, California, like other states, has required students at public and private schools and child care settings to receive immunizations to protect them and their communities against the spread of life-threatening diseases. California law allows two types of exemptions from immunizations required for grade school or child care. One type is an exemption for children who have a medical reason to avoid a vaccine. Such conditions are very rare. Medical exemptions require documentation from a licensed physician. This presentation focuses on the other type of exemption, which is for families with personal beliefs against immunizations. Effective January 1, 2014, a California law, known also as Assembly Bill or AB2109, modifies the process for obtaining exemptions based on personal beliefs. The details of this process will be discussed in the next slides. Schools, child care facilities, healthcare providers, and parents should be aware, however, that during a disease outbreak, children with exemptions may be excluded from attending school or childcare to protect them and other students from getting sick and further spreading disease. For each required vaccine, children in California 17 years of age or younger must demonstrate either receipt of the vaccine or a valid exemption before entering childcare, kindergarten, and 7th grade. This also applies to children transferring into a California school from outside the state at any grade level. Existing documentation is typically sufficient for children continuing at the same school who are not beginning kindergarten or 7th grade. If a child is transferring from one school in California to another school in California and not starting kindergarten or 7th grade for the first time, exemption documentation on file at the previous California school may be used at the new California school. In this instance, the parent or guardian typically does not need to provide new documentation for an exemption. However, records for young children are rarely transferred between child care settings. When records are not successfully transferred between schools or child care settings, they need to be provided again by the parent or guardian. Note that a child may have future requirements at later grades or ages for which documentation of immunization or exemption will be required. For example, a student transferring from another state into California at 5th grade will need to comply with requirements before starting classes, and then in 2 years would need to meet the additional requirements for all 7th graders in California. Similarly, an infant already in childcare is likely to face additional requirements before starting kindergarten. To comply with AB 2109, a request for an exemption on the basis of personal beliefs involves the following steps. Practitioner shares information. Practitioner provides documentation. Parent or guardian provides documentation. School files completed documentation. The first step is the healthcare practitioner shares information with the parent or guardian requesting an exemption. During checkups and other clinic visits, healthcare practitioners routinely share information about immunizations and the diseases they prevent. Prior to requesting an exemption for personal beliefs, the parent or legal guardian of the child seeking an exemption needs to receive information from a healthcare practitioner currently licensed or credentialed in California in one of the following categories: physician, doctor of medicine, MD, or osteopathy, DO, nurse practitioner who is authorized to furnish drugs, physician assistant who is authorized to administer or provide medication, naturopathic doctor who is authorized to furnish or order drugs under a physician's supervision. School nurse. Although practitioners in any of these categories may provide information, they are not legally obliged to do so. Contact your practitioners in advance to clarify their policies on assisting with exemption requests. The information needs to include the benefits and risks of the required immunization and health risks to the child and community of the diseases prevented by the required immunization. Resources for practitioners and parents that may help with sharing information can be found at the shotsforschools.org website. In addition to California law, please note that federal law requires that healthcare staff provide standardized vaccine information statements to parents or guardians before each dose of the vaccines required for childcare and schools is given. The statements contain information about immunizations and the diseases they prevent. As a reminder, federal law requires healthcare staff to chart both the date when a vaccine information statement is provided and the addition date of the statement. The second step is documentation by the practitioner. This official form, available on the Shots for Schools website, fulfills the requirements for requesting a personal beliefs exemption, once completed and accompanied by a copy of the child's immunization record. After the healthcare practitioner has provided the necessary information to the parent or guardian, the practitioner then checks the box that identifies the appropriate category of the healthcare practitioner. Next, attests that the information has been shared by signing and dating the form as early as 6 months prior to the child's entry into childcare or school. For example, if the first day of school is on September 2, 2014, the practitioner could sign and date the form on or after March 2, 2014, regardless of when school registration occurs. Next, enters the practitioner's name, address, and telephone number in the spaces provided. The third step is documentation by the parent or guardian. When using the form, the parent or guardian enters the student's name, gender, birth date, telephone number, name of parent or guardian, and address. The parent or guardian then documents receipt of the necessary information from the healthcare practitioner by checking the appropriate box. Next, signs and dates this part of the form as early as 6 months prior to the child's entry to childcare or school. For example, if the first day of school is on September 2, 2014, the parent or guardian could sign and date the form on or after March 2, 2014, regardless of when school registration occurs. Then, indicates the vaccines for which the exemption is being requested by checking the corresponding boxes. Next, signs and dates the affidavit at the bottom of the form. Next, along with a completed form, provides a copy of the child's immunization record so that in case of an outbreak, the school has a record of which required vaccines the child has received. While the single-page form is a convenient method for submitting the necessary documentation to request an exemption, the following alternatives are permitted by state law. Instead of the original signed form, a copy of the signed form may be used. Instead of using Section A on the form, a letter signed by a healthcare practitioner that includes all of the same information and attestations may be used. Instead of using the parent affidavit at the bottom of the form, a parent or guardian may use a signed letter. In accordance with the 2012 statement from the governor, a parent or guardian who is a member of a religion which prohibits seeking medical advice or treatment from healthcare practitioners may check the box on Section B of the form to indicate these religious beliefs. The signature of a healthcare practitioner is not required for members of a religion with such a prohibition. However, the parent or guardian must still provide an affidavit or letter requesting a personal beliefs exemption from required immunizations. The final step is the filing of completed documents by the school or childcare. Once the necessary documents are completed, the parent or guardian then provides them to the child's school or designee for filing. Schools or child care facilities receiving exemption requests need to check them for completeness. Is the child's identification information complete? Has an authorized healthcare practitioner attested to providing the parent or guardian with the required information? Is the attestation signed and dated within 6 months before the first day of attendance? Has the parent or guardian documented receiving the required information from the healthcare practitioner, or instead requested a religious exemption, in which case a signed attestation from the healthcare practitioner is not necessary? Signed and dated the form within 6 months before the first day of attendance? Signed and dated a request for an exemption on the basis of personal beliefs, indicating which vaccines are being requested for exemption? Lastly, provided a record of which immunization doses the child has already received and for which an exemption is not needed. Schools file the completed documentation for the exemption along with a completed Blue Card, Form 286, in the student's cumulative records, or sometimes combine the immunization records of all students. School staff may attach the two forms, but this is not required. As a continuing requirement, all child care centers and schools with kindergarten or 7th grade classes will need to report to the California Department of Public Health each fall how many students have and have not been immunized. Once again, please visit www.shotsforschools.org for resources to support immunization requirements. Once you are at the Shots for School website, click on the Immunization Laws page for further information and materials about AB2109. We welcome your questions and comments. Many questions are already answered in the frequently asked questions posted at the Shots for School website. If your question hasn't been answered, please contact your local health department or email your questions and suggestions to the email address on your screen. In closing, thank you for your efforts to protect the health of California's children. Let us know how we can help you.